So this short video is going to talk to you a little bit about Caesarean section. So I'm going to talk to you about elective or planned cesarean, and then I'm going to talk about unplanned Caesarean section. Unplanned Caesarean section is possibly more commonly known as emergency section, but I'm going to use the word unplanned instead. And the reason for this is the very use of the word emergency tends to conjure up in your mind a scenario where there's perhaps rush and panic and chaos and people running everywhere, and it's all very busy and fractious, okay? All an emergency C-section is, or an unplanned cesarean, is at the outset of this baby's birth, we couldn't see a reason as to why a cesarean may be needed. That perhaps something has happened during the birthing process to change that, and now it's unplanned, and that's all that it means. Unplanned means that we make a decision, this is our advice, and we would likely plan to deliver your baby within 30 to 60 minutes as a maximum. That there will be more people involved and some more equipment involved, but that, it's not going to be panic, it's not going to be chaos. In 2019, just to put into perspective for you, of all the women birthing at Harrogate, our caesarean section rate was 29%, and about 50-50 be planned elective sections, and then another 50% unplanned caesarean sections, okay? If you did need to have an unplanned caesarean section, this takes place in the theatre on delivery suite. So as you come into delivery suite and off the main corridor, there are the birthing rooms. Then theatre is literally just one of those rooms off the corridor. So you're not physically leaving the unit should you need to go for an unplanned caesarean. Common reasons for perhaps having an unplanned caesarean may be that despite regular contractions, the uterus or the cervix just isn't opening and dilating, and perhaps dilates to 6 centimetres and then for some reason doesn't carry on dilating. It might be that we've tried other things in the meantime to help that process along and that they haven't worked. It could be that we have concerns about your baby's coping mechanisms, that we feel the baby is not coping or in distress, and we advise that caesarean is the best means of delivering your baby. At the point of making the decision, more people will be involved in your care, and normally if we were doing a face-to-face class, we'd do a bit of role play to understand how many people are involved. So imagine it's just been you and your partner and the midwife, and then we decide that caesarean section is the safest option for delivering your baby. We're then going to have a junior doctor and a senior doctor who will come in and talk to you. Caesarean section is major abdominal surgery, so it is important that we run through with you potential risks, and you will be asked to sign a consent form to agree to the procedure. We will also then have an anaesthetist who is going to make sure you are comfy, and an anaesthetic assistant called the ODP. If you happen to have had just the pool or some gas and air, what we would offer then is what we call a spinal anaesthetic. If you watch a short video on epidural, a lot of things are very similar, but a spinal anaesthetic is just a very fine needle and a one-shot injection into your back, which will numb you from your toes up to your chest quite quickly. There's no piece of plastic that stays in your back. Same procedure in terms of positioning, etc. But it will actually begin to work in a matter of minutes. If you happen to have an epidural in already and you need caesarean section, if the epidural has been working well, we could likely just top it up with something a little bit stronger. So we've already added a few extra people into the party, so 2 surgeons, an anaesthetist and an ODP. It might be that a senior midwife comes in to just support the midwife who's already looking after you to see if we need any assistance. As we go into theatre, there will be a couple of theatre staff as well, and their role and responsibility is for ensuring that we've got all the equipment that we need for the procedure. If you are having an unplanned caesarean, it may also be that we ask a paediatrician or a baby doctor to be there for delivery, so another person to add in. what can I do to help me feel more calm and relaxed during caesarean section? Well, we would still encourage you to do things like perhaps bring in some music. So, bring some music in if that's going to help you feel calm and relaxed. Maybe you want to bring in, something that you've been holding, or maybe something that you've had some aromatherapy oil on, and just being able to sort of keep sniffing that just helps you feel a little bit calm and relaxed. And hopefully you're going to bring your birth partner into theatre as well. So they just need some clothes to change into, and then your birth partner would be able to join you as well. As we go into theatre, there'll be some various bits of monitoring on. So a little clip on your finger for your pulse and your oxygen saturations, some little heart monitoring dots, and a blood pressure cuff. And likely to have a drip in the back of your hands so we can give you fluids and drugs. At the point we're ready to start, we would usually pop a screen around chest height, and your birth partner would be at the top of you, holding your hands, okay? So they can still hold your hand and reassure you that all's okay. The procedure itself is around a 10 centimetre incision at the bikini line. We would have already popped a little catheter into your bladder because it's important to keep the bladder empty during the surgery, but you will have had the spinal or the epidural top up at that point, and you won't be able to feel us doing it. Some ladies have a preference that actually they don't want the screen. They are quite happy for the screen to be dropped a little bit so that they can see their baby being born. So let us know what your preferences are with that. The actual surgery itself will take about 5 minutes to get baby out, and the rest of the hour to put everything back together again. And even under a spinal anaesthetic or an epidural top-up, you will still feel something. So what the epidural or the spinal does is take away sharp and pain, but it won't take away all sensation at all. And often ladies will describe it that it feels really, really odd. My legs are really heavy and I can't lift them at all, but I can feel something going on in my stomach. It feels like somebody's kind of rooting around in there, or some ladies even describe it as somebody washing up in my tummy. And it can feel a little bit odd when you think, should I be able to feel this? But the anaesthetist will be there at the top end with you, sort of reassuring you. And if you did happen to feel any discomfort, then you can just tell us. We can just pause and get that sorted for you. So 5 minutes to get baby out. We'll lift baby up. We'll wrap baby in a swab because they'll be wet. And we're still going to do a 1 to 2 minute period of some delayed cord clamping to let that blood get back to baby. If you haven't seen it already, watch the little video on delayed cord clamping. What happens next is we'll then clamp and cut the cord, and we'll just take baby over to some warm towels just to give baby a good dry off. Then it's your choice what you want to happen. So you might want to start some skin straight away in theatre. If you think that you do want to do that straight away, then let us know and we can try to position your gown the right way to accommodate that. But if you have chosen to have a screen, remember that screen is quite high up on you, so it doesn't leave an awful lot of space for you to fit baby. But we could either drop that screen a little bit, or we can just try to get baby above the screen. Or it might be that you choose for your birth partner to have some initial skin to skin, or that you just keep baby wrapped up until the end of the procedure. At the end of the surgery, we will bring your bed into theatre, we will slide you across into the bed, and we will get your baby snuggled in skin to skin with you. Minimum length of time staying in is 24 to 48 hours. And remember, at the end of the day, it is major abdominal surgery, so it's going to take some time to get back to full mobility. 6 hours after the operation, we are likely to take the catheter out of your bladder and get you up and moving about, because we know that's the best thing to do to aid your recovery and to help reduce the risk of blood clots. We would give you some oral painkillers to help keep you comfy, and generally ladies that move around little and often are quite comfortable doing that. We talked in our birth environment video about the importance of melatonin and dim lighting, but probably for cesarean that's not going to be helpful. It's major abdominal surgery, so it's important that we do have some light so we can see what we're doing. But bringing in those other things to help you feel a little bit more comfortable and a little bit